Smoke weed every day.
Medical marijuana is a debatable topic in today's society, especially in the United States. The reason for such debate is that people all around have different viewpoints on whether or not it should be legalized everywhere. There have been many studies done to show the effects of medical marijuana on the body, both good and bad. This video will be discussing the pros and cons that come with using marijuana for medical purposes, along with the effects it has on the human body. Marijuana comes in different forms. It can be smoked, vaporized, ingested in a pill, or in edibles such as brownies, cookies, and chocolate bars. The primary psychoactive cannabinoid in marijuana is THC. THC targets the CB1 receptor, a cannabinoid receptor found in the brain but also in the nervous system, liver, kidney, and lungs. The receptor is activated to quiet the response to pain or noxious chemicals. CBC is another cannabinoid. Cannabinoid may be used to reduce pain and inflammation. It may also help in controlling epileptic seizures and treating mental illnesses and addictions, according to the National Institute on Drug Abuse. A well-known effect of marijuana is the munchies, so it has been used to stimulate appetite among HIV and AIDS patients and others who have suppressed appetite due to a medical condition or treatment. Medical marijuana is also frequently used to treat nausea induced by chemotherapy through scientific studies of the smoked form of the plant are limited.
Now moving on to the cons of the use of medical marijuana and its effects on the human body, we have starting off that it raises the heart rate. So basically what that means is that, or what that could lead to is that people who already have heart problems that want to start smoking marijuana, they will be more likely to have heart attacks in the future, just based off these previous heart conditions that they already have. Secondly, marijuana, the smoke, will cause respiratory problems, just like smoking like cigarettes or anything with smoke. It'll cause respiratory problems because the smoke goes into your lungs and the smoke damages the lungs. So take that as you want. It'll cause respiratory problems. It can lead to addiction. Scientists, although they aren't like 100% sure about this, there are many of them that say that 1 out of 10 people who smoke marijuana can suffer withdrawals if they were to go cold turkey and just stop smoking it just flat out. So there's that medical marijuana can be addictive. Also, similar to alcohol, it damages the perception. So just like if you were to drink a big amount of alcohol, you become impaired. Same thing with marijuana. If you were to smoke a ton of weed, you would become impaired. So that's also has to do with driving. Driving under influence, driving while intoxicated, basically the same thing. And lastly, marijuana has been considered to be a gateway drug, meaning that there is a higher chance of trying out other harder drugs such as cocaine, crack, heroin, things like that. Drugs that are way more detrimental to your health. And yeah, that's what a gateway drug is, and marijuana is said to be a gateway drug. So in conclusion, there are justifiable reasons for taking different stances on the subject at hand, those who are in favor of legalizing it and those who are opposed to it. There's really no right or wrong answer. It's just all based on who you ask. The only people that stand in charge are really the lawmakers, and if they want to take a certain side, then that's up to them. But that's it for this video. Thank you for watching.
Smoke weed every day.